Jonathan?
Hi, good evening. Oh, that was a little loud. Huh? So a good question would be, what is a peripheral nerve, and how is that different from the rest of the nerves in our body? And the answer to that is that peripheral nerves are in the periphery of your body, which is everything that is a nerve that's outside the spinal cord and the brain. And I think it may be surprising to a lot of you that plastic surgeons actually have anything to do with the hand or with nerves. And that's an interesting point because both of those areas actually have a very deep foundation in plastic surgery, with plastic surgeons being some of the innovators and pioneers in those areas. It's an interesting point because we actually all do reconstructive and cosmetic surgery, as you already know, but the ability to operate comfortably and to understand the anatomy and how to safely navigate the entire body from head to toe is one of the hallmarks of plastic surgery, and it's one of the things that allows us to do cosmetic surgery on top of everything else. So peripheral nerve surgery is actually an area that's really an area of expertise of our department, which is something that's only happened over the last 5 years or so. And there are several of us with specialties in that area. And I'd like to mention some of my colleagues that do this work. Dr. Janis, for instance, talked to you about the use of Botox for migraine headaches, but he's actually done a lot of the pioneering studies in the anatomy of surgical releases that go on after successful treatment with Botox for migraines. And it's a very interesting area that you should ask him about. It was pioneered by a plastic surgeon in Cleveland that was using Botox for wrinkles, who happened to be a pioneer for that use, and noticed that that several of his patients after these procedures for cosmetic surgery had their migraines go away. And he actually had the curiosity and the academic integrity to go and look and see what the problem actually was and to develop these solutions. Other areas that our other colleagues, so we have an entire center of people. Dr. Rosen is a specialist in the treatment, surgical treatment for numbness in the feet after diabetes, and actually in the treatment of nerves that cause pain, in addition to his other areas of expertise. Dr. Biedick and myself, both, and Dr. St. Cyr do nerve releases, carpal tunnel releases, cubital tunnel releases. I personally, as well as Dr. Rosen, also do releases in the legs and the feet for nerve compression that's very similar to carpal tunnel syndrome. And I personally also do nerve reconstruction after traumatic injury of the brachial plexus and the other nerves, which is a fairly specialized thing. You might think that neurosurgeons are the ones who should operate on the nerves, but the real answer is that that's an area that not many people, from internists to pediatricians to neurologists to neurosurgeons, have much true knowledge of, and we are lucky to have a concentration of that. And also Dr. Rosen and myself do facial reanimation surgery, which is in people that have loss of their facial nerves who can't move their face. We are actually able to transfer muscles that function from elsewhere on their body and connect them with a microscope, the blood vessels and the nerves, in order to allow them to smile again.